This is not NBC. This is Can TV. Channel 21.
21.
21.
Oh,
And this is Black Star. Still rising.
Still rising.
And I'm your host, Stephen Silver Black Butterfly Carter. And we're going to have a great guest encore performance for Dr. Mike Washington.
Is you sure that's my last name?
I got to make sure I get, you're not Johnson, right?
Not Johnson.
We're going to say much more to say about Dr. Mike being here, but I got to do my usual shout-outs because I get him in now so I don't forget him at the end when time gets precious. Shout-outs to Monty Payne and to Rocio Santos, my in-studio producers here that make things happen. Shout out to, first of all, the founder of the Black Star Project. That's Philip, the late Philip Jackson. Mm-hmm. Shout out to him and what he's brought, and also for Black Star Project being our host, being the sponsor of this show.
Yes.
Part of the shout out got to be with Gloria Smith, the executive director of the Black Star Project. And who can we not, oh my goodness, how can we not talk about Darius Hemmons, the executive director here at Can TV, who make this possible for organizations like the Black Star Project, having an outlet to reach our public. Yeah. Producers also is my associate producers, and that's Ellis Taylor that does the great job of publicity, getting things out. And then next to me, my other associate producer for guest engagement. Did you engage me correctly so I can be proper for the show?
Yes,
that's what you do all the time for me.
Yes, make sure you're prepared.
Prepared, right? Then we get a last minute, get stressed out in traffic, but we're okay now. Did I hit all the people I'm supposed to talk about and talk to? I think I did have them all. And
people on 79th.
79th?
Yeah.
Oh, you're right.
Yeah.
At the Atlas.
At the Atlas Center.
What about the Kroc Center?
Oh,
folks
of course.
at the Kroc Center too. Are they watching too?
Of course. Hey, how y'all doing out there? Kroc City.
Wave. Folks, all the folks that watch us on an ongoing basis, get your pencil and paper out today for sure. There are things that Dr. Mike is going to talk about that you need to know because this is a matter of having peace versus turmoil and panic. We don't want things to panic, and we're going to talk about that too. As you know, Dr. Mike has been with us before, and there's been some ongoing conversations about a subject that many of us have either some exposure to, have some concerns, and that's on dementia. And the reason for the title of this show is it's going to bring out a lot, and that's why I want you to take notes about this, because there's going to be information that many of you out there need to follow up on, but pay a special attention to.
What you got? Vice Fuce?
That's a little bit of that. You know my MO, don't you? Yeah, if I have you on 3 times, you're going to know it by this time. Yeah. But I got to make this announcement, too, because I'm going to make it later on, too.
Okay.
Take down this number, 773-285-9600. This is the number for Gloria Smith at the Black Star Project. And I'm giving you that number because you have a chance to do a 2-4. One Benjamin will get you 2 people, 2 young students, going to San Francisco for the NBA All-Star Game in February. One Benjamin, it's a 2-4. One Benjamin will get you sponsored to 2 students, will get them to San Francisco for the All-Star Game. I'm going to give you more information about that, but you're going to need to call Gloria Smith at the 773-285. You writing it down too? 9600. You're gonna get your Benjamins out the pot.
Hey,
Benjamins.
I'm a student of the game, so that might apply. You know.
Okay, and also,
what was that number? 773-285-96.
You gave me the right prompt. And also, you're gonna get information about the daddy-daughter dance by calling that number. And Gloria and the staff at the Black Star Project will give you all the information that you need. So donations are being accepted right now. Call, even now.
What's that number one more time?
One more time.
773?
Yeah, you got it written down.
I didn't
say it for me.
I didn't get that. I missed the last 2 numbers. 773-285
9600. You got it down, my brother.
Gloria Smith.
Right. As many of you know, when we prepare for a program like this, we talk about a lot of different things and then whittle it down to some precious top 10 things and tips today that Dr. Mike is going to share with us. And one of the critical things is that many of us have to acknowledge seeing the decline of a relative, relative that we will be caregivers for.
Right.
Dr. Mike, talk to us about that. I know you're talking about from a very personal point of view for folks who have not seen the previous.
Yeah, but just in general, though, it's not just about dementia. People, as I'm 62 years old, so I was talking to some of my friends, and we realized that if we're 62 years old, our parents are in their 80s. And so, the reality of illness and decline is something that is starting to, you see that more and more. You go into more funerals, you hear your friends, their parents are sick and different things. And so we're beginning to become aware of that more so than in previous years. And that's the reality of life. And we can't avoid that.
And what you brought out to me and pointed out to me that many of you, raise your hand if you agree with this, it's a difficult conversation.
It's a very difficult.
When you start seeing things in the people that you care about, love, whether it's parents, brothers, sisters, siblings, whatever, it's a difficult conversation. Tell me how that conversation went in your mind, because you don't have any siblings about those out.
Right. Well, as you said, that I'm dealing with my mom with vascular dementia, and my mother-in-law has Alzheimer's. My mother's 80, my mother-in-law is 83, I guess. Oops, I shouldn't tell their age.
Not on air.
Shh.
Cut that out.
But anyway, but they cool with that. You can see the decline, and there's nothing that you can do, and I think that's the most difficult part of that. You've always been there for your loved ones and your parents, but now it's beyond your control.
Now you're seeing the signs. What are the signs that you recognize, and then what you have to do? Because we're going to go into one major part of it, and that is when it gets beyond your control, if I can say that.
Yeah.
And you have to look for assisted living. And we're going to talk about that. I want you to get into that, please, Mike.
Well, the most fundamental things that you see, and like I said, this is not just about dementia. This is just in general in terms of activities of daily living, not being able to cook, clean, bathe themselves, get around, drive, go places. And it doesn't just about dementia. This applies to all types of care. It is not just dementia. You can see the decline. And then that's when I think we need to start beginning to have some conversations with our loved ones about.
That's the awkward kind of
seeing.
conversations that you have.
It's very awkward, because I realize that they want to maintain their independence.
Self-sufficiency, okay.
And autonomy and all those things. So it's very difficult. They don't want to have that conversation with you. And whatever conditions they have, being
and you
dementia,
not necessarily want to address it yourself, because that raises some tensions.
It creates friction between you and your loved ones. And they're also, and I think the number one thing that we have in our community is the denial that something is wrong, especially in the male population. I can try. I've been at the grocery store and I see an older man, and I try to help him a little. No, I got it. I got this. I don't need no help. I don't need no help. Now you barely can scoot. You ain't even walking with a gait. You walking with your cane and your hand in your pocket. Look like you got a gun and you ready to shoot somebody if somebody ran up on you.
I got you. I got this, right?
Right. That's what you mean. You mean I got you if you try to do something to me. Okay. But it's natural that, we don't want to give up our independence. And we'll do anything, and most people will do anything to maintain that. Driving when they shouldn't drive. Even my father-in-law, I tell them, I say, remember, we're in daylight savings time now. So you got to get out earlier.
Get home.
And get home before it get dark, because you don't want nobody to bust you in the head. You trying to come in, they in the alley. So those are things that are very important. But like I said, that conversations, we have to have them early.
We're going to talk about that, but jump into one we haven't talked much about, and that's how to identify a facility for senior citizens. Not senior citizens, but assisted living. Talk about that process a little bit for our viewers.
Well, as we were saying, once you begin to see any changes in your loved ones, activities of daily living, or in their cognitive, meaning their mind, and they're not making decisions like they used to, i.e., maybe not paying the bills on time, maybe going to the store getting lost, you need to begin to look for an assisted living facility at that point, because why? A lot of times there's a waiting list. You know, you can't just call them and say, hey, you know, I'm bringing my loved one tomorrow, right? Like you at a hotel.
Yeah.
You know, and it takes a lot of time, and you have to go and visit those facilities.
Give me some of those things when you were in that process, because I know one of it is the smell test, right?
Yeah.
Smell test.
The first thing I did once I, and before I go into that, let me say that too. As our loved ones get older, we have to move them from their primary care physician, who may have been their doctor for many years, to a geriatric.
And that's going
provider.
from a GP, general practitioner,
Right.
to geriatric. Talk about that and what the reason for that. Because I've got some friends who are looking at that for their relatives and maybe themselves.
Well, that's very important, because the geriatric doctor specializes with care of older adults, where your general practitioner or your primary care physician deals with young people, you know, under the age of 50.
Okay.
He or she might have some older patients, but in general, that PCP, the primary care physician, is not a specialty of geriatric patients. And oftentimes, and I'll give you the example, when my mom first fell and I took her to her PCP that she'd been going to for a long time, he was just like, well, you know, you're getting older and these things happen. And he was quite nonchalant
I'm glad you said older rather than old, right?
Yeah.
Okay.
Maturing.
That's right.
Yeah.
Because right now I'm an elder rather than elderly, right?
Right.
And you want to get that straight with folks.
Of course. You recognize
Be
that.
diplomatic about
Yes.
it, right?
Politically correct.
Okay.
So, yeah. So I felt that he was pretty nonchalant about the fact that she had failed, and
That's
he
just old age, huh?
yeah, well, you know, you're getting old, and you got, you know,
yeah.
your legs are not as strong as you used to. And I was like, okay, it's time to go. And so I called some of my friends, and I was like,
Now,
okay.
you talk about from an insider point of view, because you being in the medical practice generally,
Yeah.
as a pharmacist, I forgot to tell you, Doc here came out of Xavier, one of the best pharmacy schools, HBCU, in the country. He's got tradition behind him.
Shout out to Xavier, the first PharmD class, 1995. So all you young bucks out there with your doctorate degree from Xavier, know that we were the first. And we're celebrating our 30-year anniversary
Go ahead,
coming
my
up.
brother.
But we'll
Go
talk
ahead.
about
Yeah.
that soon. But yeah, so I knew right away that it was his demeanor and the nonchalantness of that kind of alarmed me. And I knew it was time to transition from the primary care physician over to a geriatric.
Was it
specialist.
difficult identifying and finding?
No.
One got
Right there, like I said, I talked to some of my people who knew how that went, and my mom was able to go over to the South Shore Senior Care Center, right over there across from the South Shore Golf Course.
So you're taking advantage of resources. Many of them are
Yeah.
free to folks.
Yeah.
Free to because you're paying taxes for that, right?
Of course,
All
you are.
these services that you should be getting should be aware of, made aware. And that's what Black Star Project and Black Star Still Rising is about, to make you aware of what is available to you. And the people and resources like Dr. Mike here can tell you what's happening.
Yeah, and like I said, it's my pleasure. You know, I don't do this, you know, just because I want to lift myself up. I'm trying to lift up my people, as well as understanding that we're the next generation. I know if you were watching TV today, they were showing that by the year 2060, there'll be over 1 million people the age of 55 and over who have dementia.
1 million.
1 million. And
I bet it's more than that.
well, that
Yeah,
of course, because we're not included in some of those.
Yeah, we're not getting into studies.
Those studies, right?
Okay.
So, but yeah, so we gotta know these things and share these things. And you know, like I said, I wouldn't be true to myself if I had information and didn't share it with you and the rest of the viewers in my community.
Now, I stopped you from getting into how you identify and the research that you go into and identify the facility that was right for your mother.
Right. So, like I said, once I switched mom over to the geriatric doctor, the social worker, Christina, thank you so much.
Shout out to Christina.
Shout out to Christina and Dr. Polsky, who's our doctor. The social worker plays a key role in that because she knows and has placed patients in these different facilities. So it's a long list that you can go to the Department of Sources, Human Resources.
Yes.
But that's a long list. So she kind of able to shrink that list down for me and say, okay, these are maybe top 5 places you should start looking.
Making it more manageable for you.
Right, because I mean the list looked like Great America. It was a long, long,
The
long.
line.
Yeah, it was a long list, and I was like, "There's no way I'm gonna call all these people and take care of mom at the same time." So your social worker is very key in shrinking that list down based on her experiences and placing people in those facilities and knowing what's the good ones and bad ones.
What's the price range, you might say, for assisted living? You gave me a range at what time? What is
The
that?
average out-of-pocket cost.
I mean, I got to go in my pocket.
In your all of them pockets. You're gonna have to go out back, front,
Okay.
side,
Some of the side
and
money.
some pants at the crib. The average cost for assisted living facility is anywhere from $5,000 to $8,000
$5,000
in Illinois.
a month.
A month, not a year. That's a month. So it's very expensive, and so that's where your Medicaid, Medicare comes into play.
So there's research involved too.
Yeah.
But you know what? But I'm sorry. Go ahead.
No, I was just saying. So once you narrow that list down, I narrowed it down to about 5 places. So I started calling them. First of all, you're gonna ask what their availability is.
Okay.
And also very important is what is the ratio and the dynamic of
Staff to the
patients.
Yes.
Also in terms of who's there. Is it a mixture of ethnic groups? It's just because if my mom's African American, of course, she doesn't want to go to a facility where it's all just one race of people.
Yes.
You want to be a melting pot of people, so it's not.
Some people speak some English and not Norwegian or
Or
German
just
or
let's
whatever.
keep it straight. You don't want to go to a place where it's just all Caucasian people and you're the only black person in that facility. So you already are traumatized because you're moving from your home to a new facility. Now you're not around anybody that looks like you.
I'm gonna direct you into some hot spots. Folks, start taking information about this. The documentation of things that you have to do to be able to facilitate.
Yeah.
Talk about that a little bit.
Okay, so
Starting with the.
So once you identify the facility, you go and check it out. Like I said, you do the smell test to make sure it doesn't smell like urine. In order for you to make any kind of decisions involving your loved one in terms of their medical, drugs, medication, treatments, you have to get a power of attorney.
Why is that so important?
Medical power, because that allows you, for example, if I'm power of attorney for you, it allows me to make medical decisions for you in case you become incapacitated in some way.
And there are different powers of attorney that cover different. Talk about the different powers of attorney, because there are 3 or 4 that you shared with me.
Right.
That the average person doesn't think
two
about.
main ones that you have: the regular medical power of attorney, which allows, say, if you got sick and you were in the hospital, I could come to the hospital and bring that form and show that to the doctors, and then I would be able to speak on your behalf, and they would be.
That's it.
Have to tell me what's going on because of HIPAA laws. That means that I can't just come in
You
there
can't just come in and get
just start
information.
asking about your health condition because
Right.
that's
They
a
have to know that
violation.
you're the person that can, and your parent or
Authorized
whomever authorized
to
that.
discuss your health care situation with you.
What about financial party? That's another area.
The second power of attorney that you must have is called the durable power of attorney.
Got that? Durable? Is that what it's called?
Durable, yeah.
Durable power of attorney. Go talk about the facets.
The durable power of attorney pertains to taking care of your finances, paying your bills. Like, if you got sick and you were in the hospital for a long period of time, and then your bills was due.
They're piling up at the apartment or the
Right,
house.
you see all these bills. I could call them, but I had to fax that in to my mom's creditors.
Yes.
And ComEd, People's Gas, all her credit cards, and say, okay, I'm the durable power of attorney. Like I
That
said.
doesn't make you liable, but it allows you.
Oh,
to,
no.
Yeah.
It allows me to speak on her behalf
Okay.
of
Make
that
clear.
person.
Okay.
I'm not liable. You are never liable. And be clear. Y'all write this down if you don't hang on to anything else. Anytime you're a power of attorney for somebody, when you sign a document on behalf of them,
Yes.
you have to make sure you put the letters POA in parentheses.
POA. What's that stand for?
Power of attorney. so that you are not held responsible
Went
for
right
that.
over my head when you said that.
Well, that's why, I'm here to help.
You're gonna help me out?
I'm helping
Okay.
you out, bro. So seriously, that's very, very important. Anytime you sign any document that pertains to you speaking on behalf of whomever, if you are the power of attorney for, whether it's medical or financial, you must sign your name and then in parentheses put POA. That means you're not signing off, like you're co-signing. Mm-hmm. If you don't write that on there, some creditors will assume that you're saying I'm going to take responsibility for these bills. So always put POA.
Tell me some of the areas that when you have these various powers of attorney, you need that navigating the medical situations.
Well, like I said, even being a pharmacist, I found it very difficult over this past year to navigate our healthcare system because there's a lot of different agencies and we live in a world now where when you call a lot of these agencies, all they're going to do is give you a link.
Oh, a link to something else, then that's a link to something else.
It's a link and it's not, those people don't know all the answers. They just give you links. And so you have to be able to go to your neighborhood center where they can help you like navigate some of those links or just go there and they can give you a little bit more information if you show up there.
What were some of the most useful pieces of information that you gathered or either heard about and found out about that you need to tell our audience about? The very practical things, you as a caregiver.
The one thing I would say is that I had to realize to put myself and whomever, once again, not just in dementia, but whatever condition, you have to imagine that person is you.
Okay.
In order to deal with that level, because it's very emotional, and your faith is challenged because you're dealing with something that you don't understand, and there's a lot going on. It's constantly going on a daily, sometimes minute-to-minute basis.
Tell the audience some of the things as a caregiver. That's got to be stressful in a number of ways. Tell me how you got through, or are getting through, and learning to get through the
like
stress.
I said, my faith is the number one thing that I realized that, my mom, brought me into this world, and so, a lot of times people tell you to move on with your life, but you can't move on. It's hard to move on when the person that brought you into this world needs you at a very critical time. So you just have to have empathy and sympathy and compassion. And like I said, I say to myself, what if that was me? How would I want someone to care for me in my time of need?
How did you have to get much more organized than you were? Because you have to organize with 2 people now or more.
Well, I write everything down on the calendar. Because
Okay.
you got physical therapy, you got speech therapy, occupational. So you have to write that down, everything, the times, the dates. There's no way you can remember all that stuff in your mind. It's impossible.
And you got to keep it handy, too.
I have a big calendar, not no little book, not in my phone. I have a big old school calendar where I can easily see what's coming up. Say if she got an appointment and someone else calls for an appointment, then I can easily say, well, no, I already have an appointment at such and such time tomorrow.
So that visual, something visual, and nothing that you have to search for and go through papers.
That gives you clarity, right? You're not shuffling through papers and saying, oh, let me go on my phone. But if your phone is low and it cuts off in the middle of that conversation. So that calendar was very, very crucial to making things simplified.
Quick check, interrupt you for a minute. Remember, I gave you the phone number. You got it there, Mike?
Yep. Again, call 773-285.
And what is that for? That is gonna be
9600. That's going to get you 1 Benjamin, gets you 2 tickets to go to the All-Star game.
You're going to be supporting 2 students from the Black Star Project.
Yeah.
Going to go to San Francisco about 3 or 4 days.
Yeah.
And they have so many things. I'm going to give you more information about that.
Okay.
About what they do on the academic side. This is not just about going to a game. It's about learning about the business of sports. In this case, the business of professional basketball. A lot to learn about that. And you're going to either be talking to not Dr. Mike, but Coach
you're going to talk to me because I'm going to sneak.
You're going to sneak it into.
Oh, I'm going to sneak on the plane.
But Coach Q, that's one of the people you'll talk to down at the Black Star Project when you call that number. They're going to give you information, how to be involved. But the main thing is that you get that Benjamin together. You're going to support.
How
many people are going to support?
One Benjamin get you two people.
A twofer.
Twofer.
Okay.
And let me just say one thing before we close. I just want to say my condolences out to my friend Tanya and my friend Daryl for the loss of your loved ones. Got nothing but love for y'all, and y'all be strong and prayers for y'all and your family.
And Dr. Mike will be strong for you like he has been for his mom and other folks who are going through this. And we welcome you. You can call me too, 312-662-3106 if you need more information, but I gave you the right number for getting some immediate information, almost 24 hours. It's not a number that you will call and nobody calls you back.
Yeah, and you can call me too. My number is area code 302-377-4422. That's area code 302-377-4422. I'm one of those people down to earth. You can call me if you got questions about dementia or any of that thing, because we have to look out for each other. We're not the only ones. You're not. If you're at home and you're watching this show, please believe you're not the only one that's going through this, and we need to create a community, a network of people that
includes
here to help.
the network Sherry Yarborough, Dr. Sherry Yarborough.
Yeah.
She has written a book, and I didn't bring it with me
It's
today.
called OMG.
Okay.
Now I'm the parent.
I'm the parent.
I spoke with Sherry last week. So yes, we got to tap in and call the Alzheimer's Association. I use that. You ask me how do I cope? I call them so frequently they know my name. Mm-hmm. Because you can't do this alone. It's not your mind is not processing that type of information. So please call the Alzheimer's Association and ask for a care consultant. They're very helpful in trying to give you resources as well as just helping you get some of those questions and concerns and stress off your chest.
I know some of the stories that you could tell me that you have told me about Mom getting on your case, brother.
Oh,
I expect that.
That'll be in the next show.
Okay,
we're gonna say that. We're gonna say that.
Can you tell us one of those things?
My mom says when she wanted to see the manager, like when she was sick, as in, like when you go to the store. But she realized the manager for her is God. And so if you actually saw God, then you realize you upstairs and you're not down here no more. And she was like, no, maybe I don't quite want to see the manager yet. So, yeah.
That's the ultimate manager, right?
Yeah, well, that's the manager.
Put the manager on the phone book, right?
Yeah.
Put the manager on call.
She's like, you're not satisfied with your results. She'd be like, I want to talk to the manager. She was like, she imagined going up on the elevator, and God was like, can I help you? And she was like, no, never mind. I'm going back downstairs.
Thank you for being with us today, folks. Look for us next week, same time, same state. Can TV, Channel 21.
Nothing but love.
It ain't NBC. It is Can TV.
All right. Thank you all. See